With geriatric veterinary medicine becoming increasingly important, we're seeing our beloved friends enjoying a longer lifespan than before. While this gift of more time is such a blessing, unfortunately, it has also led to other diseases becoming more prevalent. One of these disease processes is canine cognitive dysfunction syndrome, or CCDS, also sometimes referred to as canine dementia. In today's video, we'll cover what CCDS is, how to recognize it, and what can be done to treat it, with an emphasis on the role of nutrition in managing cases of CCDS. And we have our beautiful old girl Willow here for support. If you find content such as this interesting, useful, or even controversial, please tell us. Our goal is to connect with pet parents and help provide some insight, particularly when it comes to nutrition. Come on. Good girl. Let's start off with a definition. CCDS is a degenerative metabolic brain disorder that is associated with advanced aging in dogs. Multiple metabolic, functional, and structural changes occur within the brain, and if these changes are severe, this leads to CCDS. The disease, which affects dogs older than 8 years, is progressive in nature. Now, with age comes an expected decline in cognitive function and abilities, as is the case with people. However, CCDS is considered impairment in cognitive function beyond what would be expected to occur with normal aging. CCDS is often compared to Alzheimer's disease in people, given the marked similarities. How do we recognize cognitive dysfunction in our elderly dogs? Clinical signs are associated with gradual and progressive loss of cognitive functions. So, what we might see depends on the severity of the disease and can include problems with memory, attention, and trainability. Dogs with cognitive dysfunction may also appear disoriented, have changes in their sleep-wake cycle, and even show less interaction with pet parents and other animals in the household. There is a very useful cognitive dysfunction syndrome evaluation tool that Purina Institute have on their website. There's a link in our blog along with a further explanation. It's handy for family veterinarians to go through the evaluation tool with pet parents of elderly dogs to assess for the possibility of CCDS and, if it's present, gauge how severe it is. The tool, which looks at DISHA, which represents disorientation, social interactions, sleep-wake cycles, house soiling, activity, and anxiety, assigns a score to each category, and the overall score is used to determine severity. Depending on what study you look at, how common CCDS is in elderly dog populations can vary between 14 and 60%. With advancing age, both how prevalent CCDS is and its severity increases. Now that we've gone over some of the basics, let's look at how to manage dogs with CCDS. As is the case with humans suffering from Alzheimer's, the disease process is incurable and can only be managed. It's important to stress this point because the goal is simply to reduce clinical signs where possible and delay or slow down further progression. Management of CCDS requires several different therapies, which include environmental enrichment, nutritional intervention or targeted nutrition, pharmacologic intervention, in other words, using medication or drugs, and complementary therapies, using agents to reduce anxiety and even compression garments. So, given we're crazy about nutrition here, let's elaborate on some of the nutritional strategies or specific ingredients that should be considered for dogs with CCDS. Amino acids, particularly arginine, may help to improve blood flow in the brain. Antioxidants, particularly vitamin C and E, may help to reduce oxidative stress. B vitamins. In general, these may support brain health and metabolism. In humans, B vitamin deficiency has been linked to cognitive dysfunction. Medium chain triglycerides, or MCTs, are useful as an alternate energy source, both as ketones and MCTs, for the brain. Between 60 and 70% of the brain's energy needs can be met by ketones. Omega-3 fatty acids. DHA and EPA have anti-inflammatory activity. Other dietary ingredients that can be used to reduce cognitive decline in dogs include apoaquarin, D-alpha-lipoic acid, L-carnitine, phosphatidylserine, S-adenosyl L-methionine, or SAMe. And no, I wasn't swearing at you then. There are more details on these in our blog. So, what research is there to support that including some or all of these components in the diet of a dog with CCDS will help improve their clinical signs and delay progression? Well, a recent study from Purina by Pan et al. Showed that dogs with CCDS that were fed a diet containing a proprietary blend of MCT oil, omega-3 fatty acids, antioxidants, arginine, and B vitamins showed improvement in 5 out of 6 DISHA categories within 30 days of starting the diet, and improvement in all 6 categories within 90 days. Great, now what? Let's look at what options are available if your dog has CCDS, and in addition to other management options, you're keen to improve their diet to help manage clinical signs and slow down its progression. Here are some commercial options that you might want to consider. If you can't find a commercial option that works, for instance, because you would prefer to feed a fresh, homemade diet, we do have some recipe options on our website for senior dogs. Or, if the disease stage is more severe and your dog has other nutritional requirements, we can also assist with a nutritional consult and formulate personalized recipes tailored to your dog's needs. What's the take-home message? Let's sum it up with the top 3 points. Number 1, canine cognitive dysfunction syndrome, or CCDS, is a progressive condition that cannot be cured, only managed. Number 2, it is characterized by disorientation, changes in social interactions, sleep-wake cycles, and activity levels, and can also manifest in the form of house soiling and even anxiety. Number 3, managing CCDS relies on many different therapies, with nutrition playing a critical role in delaying progression. Key ingredients include antioxidants, arginine, B vitamins, medium-chain triglycerides, and omega-3 fatty acids. Modifying the diet has been shown to really help. Thanks for watching. We appreciate your eyes and ears and hope you bring them back here soon.